All right, guys, today we're going to cover chapter 6, which is about bones and bone tissue. So let's just start off with some general discussion about bones. We have 206 bones in the adult human body, and bones really are more than just a framework for our body, which most people kind of know that function that bones do, but they're really dynamic living tissue. They're constantly breaking down and being rebuilt. They're filled with blood vessels and nerves and living cells, and they play a really, really important job in our body. Some of the other specific functions besides shape, which is the structure we were just talking about, and the support, they provide protection for our internal organs. They provide movement of our arms and legs, as well as give us the ability to breathe. They play a role in electrolyte balance, so bones can store and release minerals, most importantly, calcium and phosphorus. They assist in blood production. Some of our long bones produce bone marrow, which is the site of blood cell formation, so that's where we get some of our blood cells. And they also play a role in acid-base balance. Bone can absorb and release alkaline salts to help maintain a stable pH. Not as much so as the lungs and the kidneys, but it does play a small role in it. Some of the classifications of bones, we have flat bones, irregular bones, long bones, and short bones. And if you look on page 81 in your book, you'll see this same picture there. Your long bones are things like your femur, which is in your thigh. Long bones are longer than they are wide. They work like levers to move limbs. So they're part of our legs and our arms. We have short bones. They're as broad as they are long. So they tend to be shaped like cubes. Some examples of these are carpal bones in our wrists, which we'll talk about farther along, and tarsal bones of our ankle. Then we have flat bones. They're thin and flat, as their name kind of says. Sometimes they can be curved. They often protect organs, such as our skull. They can be our ribs and our sternum, so they help to protect some of our internal organs. And then we have irregular bones. They're often clustered in groups. They come in various sizes and shapes, as their name kind of suggests. Some examples of these are vertebrae and facial bones. The tiniest bone in the body is found in the ear, and we'll talk about that in a couple of chapters coming up when we talk about our senses. Let's talk about long bones in a little bit more detail and talk about each of the different parts of the long bone. So we have the epiphyse, which is at the ends of the long bone. You can see here, and it would be here as well. They really play a role in strengthening the joint area for tendon attachment. They're kind of porous looking, and they're spongy bone. We're going to talk about the two different types of bone coming up. The diaphysis is the shaft or the long cylindric part of the bone. It really helps to give the bone strength. We have the medullary cavity. That's the central hollow portion of the bone. We have red bone marrow, which is going to be found inside that cavity in children and in adults. As we do get older and become more adults, that yellow bone marrow is actually changed to, the red bone marrow is actually changed to yellow bone marrow, and we're going to talk about that coming up as well. Then we have the periosteum. That's a dense fibrous membrane covering the diaphysis. Some of the fibers of the periosteum penetrate the bone, whereas other fibers weave together with the fibers of tendons to ensure a strong connection between muscle and bone. The periosteum contains bone-forming cells and blood vessels, making it a crucial part for bone survival. Then we have the epiphyseal plate. It's a layer of cartilage separating the epiphyse from the diaphysis at the ends of the long bone in growing children. When growth stops, it's replaced with the epiphyseal line, and you can see that here. So that's why bones do eventually stop growing and people stop getting taller, or their arms stop getting longer. There's 3 different types of bone tissue. Bone tissue itself is called osseous tissue, and remember back to our discussion last week, it is a type of connective tissue. Osteoblasts help to form bone, so you'll need to figure out a way to remember these. Osteoclasts dissolve unwanted bone, and then we have osteocytes, and they're really just mature osteoblasts that can actually do both functions. So they can deposit bone and they can dissolve bone. So they play both roles. All of these things are very important, but one thing that I do want you to think about is that when osteocytes experience increased load, so they're carrying more weight, they stimulate the creation of new bone. So weight bearing equals new growth equals stronger bones. So the more active people are, actually the stronger their bones are, versus people who are not as active or are bedridden, their bones are actually going to become a little bit weaker. So that's why in further discussion in Med-Surg, you're going to talk about osteoporosis as a bone disorder and how actual exercise is good for people with osteoporosis because it's going to stimulate new bone growth. Bone has many characteristics. I want to talk about 3 that your book talks about. Tensile strength is one of them. So bone is kind of made of collagen fibers in a matrix, and this makes the bone highly resistant to stretching forces or tensile strength. So we really can't stretch bone. We also have calcium salts that allow bones to resist squeezing forces. So this is compressional strength. So as much as we can't stretch bone, we also can't compress bone. And we also have torsional strength. So we really can't twist the bones either. In fact, most bone fractures result from torsional forces when they're exerted on an arm or a leg. So our bones don't do a good job of stretching or compacting or twisting. That's because it's made of this really hard matrix and the bones are actually calcified. So we don't want them to be able to be able to stretch or compress or twist. We want them to maintain their kind of hard shape. So 2 different types of bones like I talked about. We have compact bone and we have spongy bone. So just kind of, if you thought about those things, you might think about how different they'll look. And spongy bone really does look kind of spongy versus compact bone actually looks like it is very compact. So where will we find these things? We'll find compact bone in the shafts of long bones and surfaces of other bones. And then we'll find spongy bone in the ends of the long bones in the middle of other bones. So both of these things are found throughout the body. And spongy bone is always surrounded by compact bone because otherwise that bone would be actually really fragile. You can see here that we have the compact bone here. The spongy bone is in the middle, and it's really this kind of matrix, this little network of trabeculae, they call it. And this design actually adds strength without adding weight. So the cavities are filled with red bone marrow, and the red bone marrow supplies this spongy bone with blood and produces blood cells. So that's why we have spongy bone. If everything was compact bone, we wouldn't have any room to make blood cells, which is a main function of one of the bones. So this piece of this bone here, if you look in your book on page 85, that's where this picture came from. It shows you that this really is coming from the end of one of the long bones versus this next picture here, the compact bone is really coming from more of the shaft of the long bone or the outside of the medullary cavity. And you can see how much more compact this bone looks. It doesn't have that spongy appearance that the other type of bone does have. A couple of things that I want you to know here, that one of these circular structures here with 2 vessels in the middle is actually called an osteon, and that's actually one of the bone cells. So all of these are osteons together. This is a basic kind of unit, and we have compact bone made up of a whole bunch of these units. You have these canals that connect the units. The lacunae are really just little gaps between the rings that contain osteocytes. So remember, osteocytes have the ability to make bone as well as degenerate bone. So we have these spaced all throughout the bone. Bone marrow, I already mentioned this, but let's just talk about it again. So we have 2 types of bone marrow. Red marrow produces red blood cells. Yellow marrow is saturated with fat. So bone marrow is really a type of soft tissue, and it fills that medullary cavity of long bones in the spaces of spongy bones. Red bone marrow like I said, produces red blood cells. Nearly all of a child's bones contain red bone marrow. As we age, the red bone marrow can be found only really in the ribs, the sternum, the vertebrae, the skull, the pelvis, and the upper parts of the humerus, the arm, and the femur, the thigh. All the rest of the bones have converted to yellow marrow. And the yellow marrow is saturated with fat and no longer produces blood cells. In the cases of severe or chronic blood loss or anemia, yellow marrow can actually change back to red marrow to, again, start producing those red blood cells that we need. But it doesn't happen very often. Someone has to be really chronically low with their red blood cells. So let's finish up this chapter discussion by talking about how are bones made and then how do we repair bones. So there's two different processes. We have intramembranous ossification and endochondrial ossification. So in intramembranous ossification, the bones of the skull and the face start out as connective tissue. Then groups of stem cells in the tissue differentiate into osteoblasts. Remember, osteoblasts are the ones that make bone cells. We get clusters of these osteoblasts depositing the matrix material and collagen, and eventually calcium salts are deposited and the bones become calcified. So that's one way that bone develops. The other way is called endochondrial ossification. This happens with most of our bones. So most bones actually evolve from cartilage. When our moms are 3 months gestation, the fetus has a skeleton composed mostly of cartilage. At that time, the cartilage actually begins to turn into bone, and these really start the long bones of the body. So this is where we get those long bones giving us the length of our legs and our arms. It's also important to note, your book talks slightly about this, is fontanelles. And fontanelles really are these areas in the infant's skull where the skull hasn't completely fused together. Those fontanelles are there for a reason, to allow that brain in that skull to grow. We know that a baby's head doesn't stay that same size throughout their entire life, so we have to allow for it to grow. So that's really, you need to know what fontanelles are. You don't need to know all of the fontanelles. You'll talk more about that in maternity class, but I do want you to know what fontanelles are. So let's look at this endochondrial ossification a little bit. So early in life of a fetus, the long bones are cartilage. So we have this cartilage over here. And then these actually serve as kind of a model for bone development. So the osteoblasts start to replace the chondrocytes, the cartilage cells. They coat the diaphysis in a thin layer of bone. Then they start producing a ring of bone that encircles the diaphysis. Soon the cartilage begins to calcify. As the blood vessels penetrate the cartilage, a primary ossification center develops in the middle of the diaphysis here. The bone marrow cavity fills with blood and stem cells. We get that over here. Ossification continues, proceeding from the diaphysis towards the epiphyse, okay, or the epiphyseus, and the bone grows in length. And we talked about the epiphyseal plate. So the bone really grows in length until a certain age, and then the epiphyseal plate becomes fixed, and the bone no longer grows in length. Bone widening can continue throughout the lifespan, but lengthening does stop at a certain age. Everybody's a little bit different, but somewhere during puberty usually, or into their 20s. So let's watch the animation on this from Davis Plus to give you a better idea.
After about 3 months gestation, a fetus has a skeleton composed mostly of cartilage. At that time, the cartilage begins to turn into bone. This process, which begins in long bones, is called endochondral ossification. The process begins as osteoblasts start to replace the cartilage cells, called chondrocytes. The osteoblasts coat the diaphysis in a thin layer of bone, after which they produce a ring of bone that encircles the diaphysis. Soon the cartilage begins to calcify. Blood vessels then penetrate the cartilage, and a primary ossification center develops in the middle of the diaphysis. The bone marrow cavity fills with blood and stem cells. Ossification continues, proceeding from the diaphysis toward each epiphysis, and the bone grows in length. Eventually, secondary ossification centers appear in the epiphyses. Bone lengthening does not stop at birth. Bones grow in length for a fixed period. As shown by the end of this long bone, lengthening occurs at the epiphyseal plate, a layer of hyaline cartilage at each end of the bone. On the epiphyseal side of the cartilage plate, chondrocytes continue to multiply. As chondrocytes move toward the diaphysis, minerals are deposited and the cartilage becomes calcified. As long as chondrocytes are produced in the epiphyseal plate, the bone continues to elongate. Sometime between the ages of 16 and 25, all of the cartilage of the epiphyseal plate is replaced with spongy bone. When that occurs, bone lengthening stops, and the epiphyses are said to have closed. What remains is a line of spongy bone called the epiphyseal line.
So I think that does a nice job of showing you that actual bone growth and giving you an idea of how that cartilage turns into spongy bone. And then at some point, that gap kind of closes and that bone can no longer grow in length. So I want to talk a little bit about fractures. Let me show you the fractures first, and then I'll show you the animation on fracture healing. So you do need to know the different types of fracture. So this is considered a green stick fracture, just an incomplete break. So it typically occurs in young children, and their bones kind of splinter rather than break. A compound fracture is one which the bone has actually pierced the skin, so we get some external wound. And usually these people are going to need some repair, surgical repair of this bone, and probably some antibiotics to reduce the risk for infection. Simple fractures just internally, so there's no external wound. Sometimes these kind of heal on their own. Sometimes they're going to need to be casted, but they're going to take a little bit less time to heal. This comminuted fracture is when the bone kind of just breaks into a whole bunch of pieces. This is often associated with some sort of traumatic event. And then a spiral fracture, we talked about how the bones don't like to be twisted in this fashion, and so this is what happens when the actual bone gets twisted. Sometimes this is a result of child abuse, because often injuries don't happen like in a car accident. Someone's bone doesn't get twisted. It's usually by someone grabbing a hold of that limb, and this is considered a spiral fracture. So just go back and talk about how fracture repair happens. I'm going to show you the animation first, and we can briefly discuss it. Let's try that one more time and hope it works. Here we go.
When a break in a bone, called a fracture, occurs, blood vessels in the bone and periosteum are torn. This results in bleeding and the formation of a hematoma. The hematoma soon transforms into a soft mass of granulation tissue that contains inflammatory cells and bone-forming cells that aid in the healing process. Collagen and fibrocartilage are deposited in the granulation tissue, transforming it into a soft callus. Next, bone-forming cells produce a bony or hard callus around the fracture. This splints the two bone ends together as healing continues. Remodeling eventually replaces the callus tissue with bone. Uncomplicated fractures heal in 8 to 12 weeks. Complex fractures, and fractures that occur in bones with a poor blood supply, such as the neck of the femur, take longer.
But bones in general actually are going to heal faster than our cartilage or our tendons that we talked about last chapter, strictly because they have a really good blood supply, most of them, and that blood supply is going to bring those nutrients that we need. So I don't need you to understand all these steps. I just want you to kind of see it in general. I'm not going to test you on this fracture repair. You do need to know the different types of fractures. I just wanted you to have an idea about how fracture repair happens. So that's the end of chapter 6.